Hey, Coach Justin here with another golf fitness tip. I'm going to do a quick video on the 90-90 stretch. I prescribe the 90-90 stretch to a lot of my amateur golfers because very common, in fact, probably one of the most common mobility issues I see as far as the hips go is good internal rotation, right? So if we were to sit on our pelvic bones, our sit bones, get them nice and flat and firm on both sides, have your legs comfortably out in front of you, as straight as you can get them, starting with the toes up, and then just brace yourself by leaning back and planting your arms. So when I say internal rotation, that's when we internally rotate or we try to turn our femur in, right? And this is a good test to do to see how your internal hip rotation is and to see which side is afflicted more than the other. So keeping the weight even on both hips, you're going to just simply sweep or kind of turn your toes in as far as you can go without your hip coming off of the mat. And as you can see, I've got much better internal rotation on my right side, not as good on the left side. So I'm going to go through the 90-90 stretch on my left side and go through the motions of how you can really try to open up that capsule space in the front side of the hip where that femur is not articulating well. There's probably some tightness in the hip flexors and upper quads. Something else I commonly see with amateur golfers associated with bad internal hip rotation is they're usually also really tight in their rib cage on that side. And this is probably a compensation pattern because they're not able to turn their hips well. They are overturning their upper body and just putting a lot more unnecessary stress in their thoracic area and their obliques and around the rib cage because of that deficiency in the hip. So 90-90 stretch. So my left side is where I'm gonna set up first, and I'm gonna actually turn this way so you can get a good view. So we call it 90-90 because we want the knees and the hips both at 90 degrees. And as you can see from this view, it shows you very well how I have my tibia, my shin bone, parallel to the edge of this mat. My knee is at 90, coming right into the hip. Same with my lead leg. My shin bone is parallel to the top edge of this mat, and my knee is at 90, right in line with the hip. Sometimes this in of itself is already a big stretch, so we're gonna start here, and what I want you to do is put your hands somewhere comfortable and just try to sit up tall and let the weight of your body just kind of sink down until you feel that stretch really high up into the inner front side of your hip of your trail leg, right? So we have this leg that's out behind us is where we're feeling that stretch. This hip right now is an internal rotation. This hip right now is an external rotation. So staying square and tall, you want to sit here for 30 to 60 seconds to let your body settle in, to let the nervous system start to react. And when that stretch starts to lessen, to increase the stretch, you're going to start turning your body towards that trail leg, right? So I'm increasing internal rotation as I take my thorax, my shoulders, I'm turning over that trail leg. I start feeling that stretch even more, really high, deep up into that hip joint, right in the inner front part of that capsule space. Breathing technique is always super important if you want to get the most out of your stretches. So as you get to that next sticking point and you progress through these, you're going to continue to take really long, big, full breaths all the way in. And as you let that air out fully, you're going to turn into that sticking point a little bit more. If you get to a point where you can take your hands all the way to that trail leg and have your shoulders perfectly square over that trail leg, that would be your next progression. Again, holding 30 seconds, going through the good breathing technique. And then if you start to settle in and you're able to work your way deeper into that internal rotation, now we can even start to take the chest down. And I'll caution you, if you are really tight in your hip flexors, your upper quads, those big muscle groups in the front of the pelvis, as you turn, you might feel a bit of a grab or a pinching pain. And that's because if you have poor internal hip rotation, the head of that femur is sitting in that hip socket in a place where it causes impingement. It doesn't have room to articulate around. So you're going to want to work to that point, listen to your body, and progress it as things get better, as that pinching or that pain lessens over time by performing these stretches. So I'm square, and I'm going to slowly start to take my chest down more and more to get deeper into that stretch, okay? As I said before too, when I come across somebody who's got really poor internal hip rotation, as far as my amateur golfers anyways, something I keep saying too is that they're also really tight and restricted in their rib cage, oblique area, thoracic area on that same side. So I want to show you another way where we can address that issue in the same position, but I'm going to turn now. So you see our 90-90. All I'm simply going to do, I'm going to keep that same position. I'm going to turn so you can see how to do the second part of this stretch that goes really well together. So I've maintained my 90 and 90. Nothing has changed. I was over this trail leg working on that internal hip stretch. Now I'm going to turn away from that trail leg. And remember, this is our anchor, this is our base. We're not going to change anything about our 90-90 position. I'm going to turn my shoulders as much as I can away from that trail hip. And I'm starting to feel a nice stretch in that trail side rib cage area. I'm even starting to feel a stretch now a little bit into these hip flexors and upper quads that are going to be tight and contributing to that poor internal rotation. If you're able to get your shoulders completely square behind you and you're not to that 7 to 8 sticking point of discomfort, we've turned, I've gone through the breathing technique. Remember, we're continuing these long, deep, slow breaths as we get into the positions, as we push sticking points the entire time. If you get the shoulder square, now you're going to start to walk the arm that's on the same side forward. And as I walk that hand forward and take my head and chest down, I'm still trying to kind of turn my shoulders like I'm looking behind me. And I'm increasing that stretch in the rib cage. I'm starting to feel even more stretch in my lats too. And then you're going to take your head and chest down without changing anything about that 90-90 position behind you. I recommend you hold each of these positions for at least 30, if not 60 seconds. If you're able to progress and go to the next position, you're going to hold that position for another 30 to 60 seconds. And even though my left side is my more restricted side, you're going to want to do this on both sides, all right? And like I said, the 90-90 stretch, extremely dynamic and beneficial to the amateur golfer who has trouble internally rotating that trail hip. It's going to affect everything above. It's going to lead to a lot of the common compensations we see, like lateral instability. So you're going to see them moving side to side, maybe excessively sliding, swaying. And it's going to lead to overuse of the upper body if we don't have that room or ability to turn our hips as we shift our weight and have the control to stop it as we go through the downswing. All right. Thanks for joining me. That was the 90-90 stretch. I hope it helps.